We've run a number of smaller capital campaigns at Murdoch University in the past, and in each case the university employed external consultants to run the campaigns with varying degrees of success. In 2007, we started planning our largest campaign to date to support the establishment of an institute focusing on immunology and infectious diseases. Given the size and experience of our team, we decided that we needed assistance in the planning of such a large campaign. But rather than appointing a consultant to run the campaign, we decided to take a different approach. We wanted to work with someone who could help to upskill our team to prepare us for this and future campaigns. We wanted an organisation that could provide strategic advice and coaching to our team, and one with awareness of national and international funding sources. We considered a number of agencies and eventually appointed Global Philanthropic to work with us on this campaign, and in particular Dr. Daniel McDermott, who has significant expertise in health and education fundraising. The focus of the campaign was on raising funds for a new building on campus to house the Institute for Immunology and Infectious Diseases. The Institute would be home to an outstanding team of researchers led by Professor Simon Malal. Professor Malal is an internationally renowned researcher working in the area of HIV/AIDS research. He'd already received funding for the team's work from the Bill and Melinda Gates Foundation and from other international and Australian sources, and his goal was to expand their research into other infectious diseases. The university was successful in securing federal and state government funding for the institute, but we also needed private support to make the institute possible. As we worked through the planning for the campaign, we thought about potential donors to approach, and we realised that we needed broader support than just those people who care about the impact of HIV/AIDS. At the same time, we were aware of growing community complacency about HIV/AIDS, regardless of the fact that the United Nations still lists it as the world's most significant health issue. In Australia and in many other countries, numbers of HIV/AIDS cases are on the rise. It was important to help potential supporters understand how devastating infectious diseases had impacted on populations in the past, as a context for what's happening now and what will happen in the future. Daniel McDermott had seen something similar internationally and suggested that we develop a historical disease timeline showing how pandemics had devastated populations in the past to provide a context for current and future pandemics. We researched major infectious diseases in the past and came up with some frightening statistics. We really had no idea how many pandemics there had been and how many millions of people had died from diseases such as smallpox, malaria, cholera, polio and Spanish flu. We used the disease timeline in campaign brochures and presentations to individual prospects. It really seemed to help people understand the context of the research and the importance of the institute. Once the institute building was complete, we ran a fundraising dinner for a select group of potential donors to gain support for equipment and ongoing research costs. We turned the disease timeline into a video that captures the impact of diseases in history and poses the question about the impact of future diseases. It's a very simple but clever concept, and it helped people understand how vital the research work is and how it's relevant now and in the future. The video was used during that event, and we now use it for individual presentations to potential donors to help them understand the cause and its ongoing relevance.
What is the greatest long-term threat to humanity? It's not war, even though World Wars I and II combined killed approximately 80 million people. It's infectious diseases. Smallpox, identified nearly 12,000 years ago. A vaccine was discovered in 1796. The disease was eradicated in 1979. It killed up to 500 million people in the 20th century. Malaria, identified nearly 5,000 years ago. Quinine treatment was developed in 1600. It's still killing up to 3 million annually. Tuberculosis, identified 2,500 years ago. An antibiotic treatment was discovered in 1946. It's still killing up to 2 million annually. The Black Death, identified 700 years ago, killed 75 million. and ended in the 17th century. Cholera. First pandemic in 1816. 7 pandemics since. It killed 1.5 million in the 1970s. 100,000 were infected in the 2008 Zimbabwe outbreak. Polio. Identified in 1840. A vaccine was developed in 1952. Deaths were reduced by 99% in 2006. Spanish flu. Between 1918 and 1920, it killed up to 100 million people. HIV/AIDS. Epidemic started in 1981. It has killed 25 million so far. Another 30 million are living with the disease. There is no vaccine yet. SARS and avian flu. The latest infectious disease threatening humanity. What will be next? Infectious diseases have been around forever. They have killed more than 1 billion people in the last century. Infectious diseases form the greatest long-term threat to humanity. But there is hope. Part of the answer to this global problem lies in Western Australia. In this building, with people in this room.